but those are just very beneficial in terms of repair, cellular repair and tissue repair, lowering one's, propensity for heart disease, developing heart attack and stroke and things like that. It will actually help to reverse a lot of those. If you have genetic predisposition for that, it will actually help to reverse a lot of that stuff. And also really good for people who have any predisposition for dementia, Alzheimer's, and things like that. There's actually going to be a much lower likelihood of you developing that if you're doing this on a regular basis. So 4 times a week is what it's recommended.
Today on the Veterans Voice podcast, we're sitting down with Dr. Mike Hjelkrem and Dr. Eric Abbott, 2 veterans, Army, Air Force, and now providers for Optum. How are you guys?
Very
Great.
good.
Thanks for having us.
Thank you.
Yeah, for sure. Well, I appreciate you guys coming on the show, taking the time out of your day. I know you guys are both very busy and time is valuable, so appreciate you guys being here.
Absolutely.
How about we just start with a quick, military background and medical background for both of you, just kind of get to know you guys a little bit.
Absolutely. Well, yeah, I'll start. So Eric Abbott, I retired as a lieutenant colonel from the Air Force. I was in for a total of 25 years. Started out as a logistician and crossed over to the dark side in 2003 and went to a health profession scholarship program, medical school out in New Jersey. And after I was done with that, went off to be a flight doc actually here in Colorado Springs for a couple of years, and then went out to Nevada, Nellis Air Force Base for residency, and then just was active duty after that. Primary care, did some internal medicine, some geriatric type stuff, and that prepared me for being with Optum upon retirement. I took about a year off and then came on with Optum in September of 23.
Okay. Quite the journey.
Absolutely. Yeah.
Started in the military though.
Yeah.
It's cool to hear. Mike, how about you?
I did ROTC in college, then went to medical school at Uniformed Services in Washington, D.C. area. And then after that, did all my training at Brooke Army Medical Center. Then finished up in internal medicine, did internal medicine for about 4 years, deployed to Iraq for 14 months. And then went into GI after that. Did a few deployments to Eastern Europe, and then retired at 21 years, a colonel. And I was actually born and raised here at Colorado Springs, so plan was always to end up here in Colorado Springs. Had to ask everybody in the entire military, pull some strings to get back to Colorado as my last duty station. Yeah. Worked out well for me.
I'm guessing you're quite the outdoorsman then.
Yes, used to be, not so much anymore with 3 kids and stuff, but
cool. Well, yeah, like I said,
love it, yeah.
You guys have had quite the careers, so utmost respect for you guys here, and I appreciate you coming in. But today we're going to talk about a couple very relevant things. We're going to talk about sleep, the importance of it, how it affects the system if you're not consistent with it, some negative side effects if you're if you're not treating sleep appropriately. We're going to get into nutrition, obesity, childhood obesity. We're going to talk about some of your specific practice as a gastroenterologist, and kind of just everything in between.
Awesome.
See where it goes.
Yeah. Again, thanks for having us.
Yeah, for sure. So let's start with sleep. So in regards to sleep, I know the body has 11 major organ systems, from our nervous system deep within us to the integumentary system we show the world every single day. How does sleep affect all of these systems within the body? Why is it important? And how is it hurting us if we're not respecting it?
Well, it's something that's really easy to neglect.
For sure.
But sleep is extremely important. The human body is actually really sharply attuned to the rotation of the earth in terms of that 24-hour cycle. And there's a portion of your brain called the suprachiasmatic nucleus, and that's like a fancy name, or the SCN. But essentially, it's this bundle of nerve tissue that sits in your hypothalamus, and it is connected to photosensitive cells in your retinas. So when that signal comes in, the light signal comes in, that's what causes that to release chemicals and things to basically help you wake up in the morning. It releases cortisol, helps you to release cortisol in the morning, helps you to release melatonin at night so you can go to sleep, and it helps just kind of regulate your organ systems and your mood and your activity cycles and things like that. So a slight little bump to that system can actually really throw off your entire system in ways that people don't really realize until it happens to them.
What might that bump look like if, like, you know, someone isn't treating sleep accordingly and they go through that little misstep in the circadian rhythm? How does that start to show up?
Absolutely. So drinking too much coffee or too late in the day is definitely one. Or if they're dealing with shift work where they have to switch over from nights to days or days to nights, that'll definitely do it. Certainly daylight savings time is a big one, and it doesn't really seem like it would be that significant. It's just an hour, you know, but losing an hour can really throw people off and cause them to have to try to make up for that sleep over the next several weeks or so. That 1 hour can cause them to have issues with their mood and worsen their anxiety, and it can worsen their sleep apnea. And they can really be dragging for a while.
So coffee late in the day, or just caffeine in general late in the day, will mess it up. How about first thing in the morning? I know a little bit about it, but how does drinking coffee as soon as you wake up maybe affect your day versus if you delay caffeine intake? Do you know much about that?
I really don't. I mean, it's more of a personal preference. I will say that the healthier people will drink water first and maybe get some exercise in and so forth, and then have their cup of coffee. I just dive right in and have the cup of coffee and then exercise and then have water. And that's probably that's definitely the wrong way to do it.
Yeah.
So
who knows? I mean, to each their own, right?
Right. But minimizing caffeine intake is always a good idea.
Maybe you guys can confirm this, but I did read an article about how caffeine is an adenosine receptor blocker. And when we wake up in the morning, we're very groggy, and it's because of a buildup in adenosine within our bodies. And if we don't allow that to burn off properly within the first 90 minutes or so, that's what leads to the afternoon crash. So if you drink caffeine right as soon as you wake up or within 90 minutes, you let that adenosine still build up. Now you just inserted caffeine between the adenosine and the receptor that's going to digest it. The caffeine wears off 5-6 hours later. It's now 2 p.m. and you get that afternoon crash.
You actually just explained something that I have not understood my entire life.
Hey, I taught a doctor something. That's
pretty cool.
Totally
did. I'm completely serious, because for as long as I can remember, I would always hit the wall at 2 o'clock in the afternoon, like without fail. And I could never figure out why that was happening. So
thank you for sure.
Yeah, no, that's awesome.
We'll have to do some more research, but
Well, all this bad talk about caffeine. I mean, actually, caffeine has a lot of good health benefits, especially with my GI system. The liver one. I mean, if you have fatty liver, it's recommended that you have 3 cups. Of coffee, as long as you don't put a bunch of cream or sugar in it. But
that helps. Fatty liver, really?
Absolutely.
That's awesome.
It's one of the recommendations too. It's it has a lot of anti-fibrotic properties, and then prevents inflammation and moving from fatty liver to non-alcoholic.
So would you ever put someone on a regimen of coffee or caffeine?
So if people have fatty liver disease and they have inflammation on there, we recommend that they have 3 cups of coffee in the morning, of course. And then, but the big key is, don't put a bunch of sugar in there, and don't put a bunch of cream and fatty stuff in there. So it's supposed to be just black coffee. And it's something about coffee too, because they have done studies on Diet Coke with the caffeine in there and caffeine-free coffee and stuff, and those don't have the benefits that coffee does.
How about like green tea? Because I know green tea is caffeine.
Yeah, and teas and stuff also do not have it. So it should be black coffee.
So it's something about the coffee bean itself. I stopped drinking coffee until very recently. I have a cup when I do interviews in here. I don't know. I feel like it gives me a little bit of a mental clarity.
Right.
Because I had a little bit high blood pressure. So I just cut back. But I was drinking about a pot a morning by about 9 o'clock until I had learned about that fact. Stopped doing that, and I just cut all caffeine. So I'm slowly inching back into it. But now I have more of a reason to drink more coffee.
Required in the military is a bunch of coffee in the morning.
Required. They issue you coffee, actually.
Motrin and coffee.
And basic.
I don't think we call it coffee, though. It's like mud water,
Mm-hmm.
engine oil, or it's either like water with a hint of brown, or it's just pure brown and it's thick. There's never an in between.
No. Well, Air Force coffee in particular has a very specific taste to it.
You guys got like Starbucks and all kinds of stuff. I'm talking like mermites out in the field when you haven't slept in 3 days and they're bringing you out this coffee jug.
We could
MRE coffee.
He gets it. We
should do the study on dipping the coffee packets, just like
done
fan
that
them off. And
right.
them
it's right out of an MRE.
Yeah.
Let's get back into sleep a little bit. Maybe like in reference to stress and the nervous system. I know this is very prevalent in the military, but we never have a consistent sleep cycle.
Mm-hmm.
And when you do, it's quickly disrupted by a training or a late night or a deployment or something like that. So in regards to stress, anxiety, even, how relevant is sleep?
It's super relevant because when your sleep cycle is thrown, certainly depression and anxiety can go up. They even realized that for people that had brain lesions, like they had TBI, for example, or damage to the brain secondary to a compressive lesion or mass, or people with Alzheimer's disease, for example, who have like neurofibrillary tangles in the brain, and it can alter the architecture of the brain parenchyma. If that is compressing the SCN that I was talking about, the suprachiasmatic nucleus, that'll alter the sleep cycle as well. So people that are developing dementia will actually, that's one of the telltale signs, is that their anxiety gets worse, they get combative, they get angry, and then their sleep cycles are all over the place. So one of the best things you can do to treat someone that's dealing with depression and anxiety, along with good nutrition, which we're going to talk about later, is trying to get them to regulate their sleep cycle. And it's recommended that it's okay for them to take a sleep aid if necessary, because that's only gonna help. Ideally, it's for a short period. It's not forever and ever, right? But that's part of adequately treating some depression and anxiety is regulating that sleep cycle. So it's really, really important.
Let's talk about some ways to regulate the sleep cycle. So whether it's a supplement of some sort, I'd love to hear a couple, but evening routine, morning routine, let's kind of talk about those a little bit to just, further regulate and be more consistent about sleep.
Yeah, absolutely. So sleep hygiene is a really important thing. And we always I have patients that come into me all the time that tell me they can't sleep and they want something for sleep. Various things you can do for sleep. So you can use valerian, which is like something you can find over the counter pretty easily. That's a root or a flower. Can't remember which. Kava root is pretty good as well. They make that in a tea, although that can be kind of rough on the liver, as I'm sure you can attest. So that one you have to be careful with. Certainly medications like Lunesta, Ambien, meds like that. Trazodone is another one. So they're all hydroxyzine. There's a long list of meds that you can use. We consider them last resort. We try to get people to first back off the caffeine. So if they're drinking caffeine after noon, try having your last cup maybe at 11 o'clock or at 10 o'clock in the morning. Exercise, it's better to do that in the morning or in the afternoon. Try not to exercise in the evening because your cortisol levels are going to be up and you're going to have a difficult time going to sleep that evening if you exercise too late. Certainly eating eating anything like high sugar and things like that at night, that's going to probably keep you up, although you could also have a sugar crash and you could sleep better for a while.
Yeah, how about just eating like even just a healthy meal later in the day? I've read, if you eat maybe at 8 p.m. and then you go to bed at 9, your digestive system is now very active, right? And therefore it's harder to sleep because there's systems within your body that are working harder than they should. Eating
too late, definitely, especially if you have acid reflux.
Yeah.
That'll be keeping you up.
Yeah.
You have any input on that, Mike?
Yeah. I mean, acid reflux is a huge, huge cause of people not being able to sleep. I mean, it's one of my big causes too, but, and then eating late at night, you can just have acid production coming up and that'll wake you up serially over and over again throughout the night and not allow you to have deeper levels of sleep. I mean, the other one we haven't talked about, maybe you were going to get to, is alcohol. So a lot of people think, I I can't sleep unless I have a glass of alcohol or so at night. And that's actually kind of the opposite. I mean, maybe you'll go to sleep right away, but the quality of sleep that you'll get, I mean, you know this a lot more than I do, but the quality of sleep you'll get throughout the night is a lot worse. It won't let you go into the
REM.
Right amount of REM.
Right.
And then you'll overall just that build up over time, not getting quality sleep every night is going to just have.
For sure. Just sidetrack real quick. I don't know much about acid reflux. So you might just kind of filling us in how it shows up, how you might feel it.
Well, that's a huge topic too, but a lot of people feel it. They feel acid burn coming from lower below like your chest area and then coming up all the way up into your like esophagus area, the upper part of your chest, and even into your mouth. And that's the classic pyrosis or acid reflux. But a lot of times, and a big part of the population has silent reflux where you don't even feel the acid reflux, but you have acid reflux coming up, irritating the esophagus. And that irritation in the esophagus, even though you don't really have any terminal nerve endings in the esophagus itself, it can cause irritation enough that stimulates things like the vagal nerve, and that burning sensation there can also cause people to wake up, and it can come all the way up into your mouth. You have regurgitation, and all of those things can make you wake up at night if we're still talking about sleep, but cause damage in the lower esophagus. It's one of the biggest leading causes of something called Barrett's esophagus, and that can lead to esophageal cancer. So acid reflux over time can be very detrimental.
Is it hereditary, or is that something we kind of create ourselves?
Both.
Okay.
But big time create ourselves through diet and being overweight. And then it is hereditary in the sense that you might have things like a hiatal hernia, which is the diaphragm is where the esophagus goes through from your lungs down into where your stomach is. And that area, that hole where the esophagus goes through, hereditarily can be a little bit more open. And then that can not have as much tightness on that lower esophageal sphincter and causes the acid to go from your stomach back up. And if you have a hiatal hernia, that's when your stomach is up above that diaphragm, and that just causes acid unobstructively to come up and down. I'm making up a bunch of good words here. So.
Okay. But we might have just scared some people. So how do we prevent this? How do we make sure we get ahead of it and don't end up with acid reflux?
Yeah. Diet, exercise, lose weight, sit upright, don't eat before 2 hours before going to bed at night. And then the type of foods is big too. I mean, the very high acidic foods are things like tomatoes, oranges, and lemonade and things like that. But other things like alcohol can lower that esophageal sphincter pressure, causing acid to come back up. And then cheese and chocolate all kind of lower that esophageal sphincter pressure and cause acid to come back up. But just girth and weight causes that pressure in your abdomen, pushes that pressure in the stomach, pushes everything back up into the esophagus, causing acid reflux.
The Veterans Voice podcast is sponsored in part by Optum and is produced in the Optum Podcast Studio. Optum and Mountain View Medical Group offer 20 clinics throughout the Pikes Peak region. Their primary and specialty care doctors provide quality, patient-centered care backed by Optum's leading health services and technology. They are dedicated to helping our community live healthier while keeping care affordable. Visit optum.com/Colorado today for more information. Good to know. So we were talking about sleep hygiene, not eating, 2 hours, I guess we're going to call it 2 hours before bed. What else about sleep hygiene would you have to kind of input here, recommend to people?
Right. I mean, also, you really want to maximize your sleep environment, right? So, you don't want to have really bright lights in the bedroom. I mean, try to have some dimmed lighting. Certainly when you're sleeping, you want no light if you can help it. You don't want a big night light off to the side that's really bright, or your alarm clock light is too bright. You can dim that down or turn it around or whatever. And you want to reserve the bedroom for primarily for sleeping. That's not the place for us to sit on our laptops and chart, and work and check emails and things like that. You don't want to be eating in there, and it's really should be like a sacred space for you to just kind of wind down and relax. Otherwise, your mind and your brain will start to associate that space with the stress of work, and then you'll just lay there staring at the ceiling thinking about work all day.
Totally get it.
So yeah, aromatherapy is always really good, actually. So if you can waft around some lavender using one of those diffuser machines, I guess you could say, you can plug them in. Chamomile, just certain scents are known to calm you down. Others are gonna wind you up and be more of a wake up thing. So, but stuff like lavender can calm you down. And ritualizing bedtime in terms of you kind of think to yourself, okay, I'm going to start winding down now. Take a nice hot shower, change clothing, maybe do some reading, that kind of thing. And then what's really helpful too is that if you can't sleep, it's good to get up and leave the bedroom, go somewhere else in the house, sit and read or write down whatever's on your mind, whatever's bugging you. A good practice is to write that down. And then you kind of set it aside as like, okay, I'm going to deal with this tomorrow. And then you'll find yourself getting tired and sleepy, and then you go back to bed. Yeah. But what you don't want to do is lay in bed and associate being in bed with not being able to sleep, because then that'll perpetuate itself.
Discipline with going to bed on time, sleeping through the night, waking up on time. This isn't something that's exactly taught to us in the military. You guys both know that.
Right.
So I think getting out, I don't know if you guys relate to that. Personally, I would stay up very late thinking I had to keep working on stuff, waking up super early. And I was kind of running myself through that burnout cycle when I didn't need to be. Right. Because I got out of the military a year ago. But, prioritizing sleep. And I think we talked about this in our previous episode, like rest before exertion is paramount when it comes to performance. Right. And sleep is just that.
Absolutely. Yeah.
I'll try and blow your mind one more time. So people who can't, wake up on time, they set their alarm for 5 a.m. They snooze. A good way to avoid that?
How's that? Where you can't reach the snooze button, or that's my guess.
Kind of. Yeah. Put it on a shelf not near you. Right. But you set your alarm for your bedtime so that you ensure you go to bed on time every night. Which will enable you to wake up on time every morning. Right, so if you want to go to bed at 9, wake up at 5, set an alarm for 8:30, or maybe you set an alarm for 8, phones off, brush my teeth, have a lavender tea, get in my hygiene routine, and then you're in bed by 9.
Go to bed at the same time every day and wake up at the same time every day. And
Yeah, exactly. Do you guys sleep pretty consistent schedules? Like I'm a 9 p.m. to 5 almost every single day. Saturday, I'll let myself we'll stay up late to watch a movie, but that's the only day.
Right.
Yeah.
Yeah. I typically do 8:30. I'll go to bed. I'll get up at 4 or 4:30 because I like to do a bunch of stuff in the morning, work out and stuff like that. And that seems to be a really good cycle.
Yeah. Yeah. It's almost like a superpower, having that consistent circadian rhythm. You just feel like you're performing on all cylinders.
Absolutely.
Or all batteries. I guess we're in 2025.
Yeah.
I think there is something about catching up on the weekend though. It's okay to sleep in on the weekend, because I think your body does adjust and get rejuvenated from that catch up time.
It does feel good to do it. Not gonna lie,
it feels good.
I do it.
Yeah.
I've read it can throw you after a few days, because then you're not used to getting up as early, and then when Monday rolls around, it can be harder. But I don't know after how many hours that's a thing. I don't know if it's after 48 hours, 72 or 24 or whatever it is, but I totally sleep in for a couple hours.
Yeah.
Yeah.
And then when I sleep in, I have a hard time going to bed at the same time that night.
Yeah.
So, that rhythm is so precious, and you can take advantage of it.
Absolutely.
How does altitude play a role in sleep? Does it? I'm just kind of curious, because we're at 6,000 feet right here.
Absolutely.
Yeah.
Go for it.
So altitude, basically because we're so high up that there's less atmospheric pressure pushing down on us. It's kind of like when you go diving, not that I have any diving experience, but being underwater, deep underwater, the pressure of the water is going to be a lot heavier on you the deeper down you go. It's the same thing above water, right? So the higher up, if you're in Florida, you're going to have a high atmospheric pressure pressing down on you. If you're up in Colorado, Himalayas, whatever it is, there's going to be less atmospheric pressure, and there is less oxygen at altitude as well. Obviously, we all know. And so the brain really digs oxygen, right? And if you're new to that kind of elevation, your body is going to ramp up trying to get as much oxygen as possible. So your heart rate's going to go up by itself. Your respiratory rate's going to go up by itself. And so there's a little bit of a sympathetic response that's attached to your body kind of ramping up a bit to provide adequate oxygen intake for your organs and muscles and things. So you're not going to be able to sleep as well. You're going to be more arousable and more easy to wake up and more kind of tossy-turny. And the sleep center of the brain actually also gets really irritated with relative hypoxia and will make it difficult to go to sleep and stay asleep.
Makes sense. It's kind of like a danger signal.
Right.
We don't have enough oxygen. Maybe like you go from 98 while you're awake, and then at altitude, or at normal altitude, you're at 98, SpO2 100, and then at altitude, you're at like 95, 93. That's probably enough to start aggravating that a little bit.
Right.
Your body's like, what's going on? Absolutely.
Yeah. So you have to give yourself time to acclimate, and you want to make sure in fact, I even saw some things that said, like, if you're really high up in altitude, you could actually alter your environment with like an oxygen, there's some sort of oxygen device that you can have. I don't know if it just like blows it around or something like that, but apparently they make that sort of thing. Like if you're going to go to Peru or something on vacation, go to the Andes, you can have this device that will help to mitigate altitude sickness and things like that. Yeah.
I'm going to put one of those in my bedroom.
Right.
Just to sleep really well.
Yeah, exactly.
Well, I want to segue into nutrition, a little bit more, childhood obesity. Is there anything else you guys wanted to cover in regards to sleep?
Just make sure you get it.
Yeah, agreed. Cut. Well, yeah, there's a recent CDC statistic that I saw. Less than 1 in 10 children are getting enough vegetables. And I think that was a Colorado specific study, which is one of the U.S. most healthy states is Colorado. But, let's just talk about this for a second. Less than 1 in 10 children, I guess, 1 to 18 are getting enough vegetables. What kind of impact is this having on development, cognitive function, obesity rates, everything in between?
Yeah, no, I see it. I definitely see it. And it's everything in the United States and all the availability of fast food and the easy foods. And I mean, my kids are heavily into sports after school and stuff. And so we don't have time to sit and make vegetables. It's much easier to just do something out of a box. But obviously those just carbs, and not as much, vegetables and healthy things for sure. I definitely see it. But I mean, in my specialty, the fatty liver is just becoming an epidemic in the pediatric population as well.
Really?
And,
Really?
Oh yeah. So and that's all diet. I mean, obviously it's riding around in cars and stuff too, and not getting enough exercise. But diet's the big one. So what we usually say for people with fatty liver disease and a pediatric overweight epidemic as well is when you're in the grocery store, don't buy anything in the aisles in the middle of the grocery store. Do all of your shopping around the edges, because that's where they have the vegetables on the edges. Then you go into like the dairy and the meat section. Try to bypass all the donuts and all the bakery. That's on the outside of my King Soopers. But But besides that, just do everything on the outside and try to stay away from like the boxes and all the boxed food and all that processed carbohydrates, which are really bad. And
so yeah, from a gastroenterologist standpoint, the difference between processed foods and whole foods on your digestive system.
Huge. Yeah. There's so much inflammation that goes along with these processed foods. Our bodies are just not made to deal with that. Our bodies very much better handle the vegetables and the meat and all the more natural foods than these cereals and sugars and cookies and chips and things like that. So, inflammation is just one. Just you just pack in all of that stuff. You build up, you eat those carbohydrates and it goes straight to sugar, and all that affects your pancreas. You have a lot higher rates of diabetes, and then it just sits in organs. Fat in the liver is all from this, just going into your liver rather than being processed, and that's all carbohydrates and sugars that you eat, and then it goes into peripheral fat as well as visceral, which is in the organs, fat. Whereas if you eat vegetables and meat, that you don't get that huge sugar load. You get all those nutrients that your body has to metabolize and use rather than just easily stored.
Interesting. Yeah. So, in regards to childhood obesity specifically, you're saying, you're seeing fatty liver disease. It's becoming an epidemic. What other things might eating more processed foods be exacerbating in children? Maybe like heart disease, or just other things of that nature. What are these children going to be seeing earlier in life if they continue eating this way?
A big thing is sleep. A big thing is mood, because they have that immediate sugar load, so that they get sugar highs, they get sugar lows, and that can all affect mood. It can affect your concentration in school. Later on in life, sure, cardiovascular disease, and then diabetes, of course.
Yeah, man. Sad to think about. I don't have children yet, but that's tough. Because I totally understand the convenience too. It's become the norm, especially in America. But I just worry about the future.
Yeah, but the big thing with my family is just my kids don't want to eat the healthy stuff too. So it's just so easy to be like, our busy lifestyle, we're going to school. Why don't you just take that cereal that's in the cabinet rather than having an egg or, stuff like that.
Yeah, path of least resistance. Yeah. That's kind of the way we go with everything. Yeah. Eric, you're an in-shape guy. What kind of nutrition advice you got?
I fake it well. I fake it well, man.
Yeah.
It's interesting, that the timing of you calling us to the podcast, because those are the two things I had been really focusing on a lot lately, were nutrition, and then, of course, the colorectal screening, which we'll talk about a little bit. And ideally, 4 to 5 servings of vegetables and fruits per day is what's most beneficial. There was a study that Harvard Medical School did where they were comparing people who had 2 servings versus 5 servings a day. And they found that, not surprisingly, that 5 servings is actually a lot better and diminishes these chronic diseases that we're talking about, obesity, hypertension, diabetes, and so forth. And it doesn't mean you can't have grains, but they should be whole grains. Meats are definitely good as long as, in particular if they're lean meats, right? So
chicken, fish.
Chicken, fish, or meat that's at least lean, it's not marbleized.
Filet mignon.
Right, exactly. And, Mediterranean diet, right? And then a really good, very intuitive way of shopping in the produce section and in the fruits and vegetables section of the store is just lots of colors. So the more red, the more green, the more blue the more colorful you find stuff, the better off you are, and you can make your smoothies and your salads and it doesn't mean you can't still have meat, but if the majority of your diet is the fruits and vegetables, you're just going to feel so much better, and you're not going to develop a lot of stuff, health issues that you would develop otherwise. And there's an article I wanted to cite, which is just it's a quick, easy read, and it puts some data out that would be really easy to just kind of find and absorb. It's a good resource. So if people it's a Harvard Medical School study. So if they go to www.health.harvard.edu, and this is Harvard Health Publishing, there's a section on nutrition. And the name of the article is How Many Fruits and Vegetables Do We Really Need? And that's an article from September 1st, 2021. And I thought that really kind of lays it out clearly.
Okay.
Because people always wonder, well, how much is a serving? And how do I know what is 1, what is 2, and how am I supposed to fit this into my day and that kind of thing. And that's a really nice, intuitive, colorful resource as well. It's got some awesome photographs in there in terms of what 5 servings looks like and that sort of thing. So,
okay. Yeah, I'll put that in the description of the video. Appreciate it.
Absolutely.
I just kind of had a little bit of a epiphany here. Like it's instinct to look for colors when we're eating, right?
Yep.
Like the red peppers, the yellow peppers, the green this, it tells us that it's nutritious.
Right.
Marketing is banking off of that, which is why Lucky Charms looks more appetizing than mini wheats or Life.
No, I think that's probably right on.
But those are in the aisles. We just got to stay out of there.
Stay out of the aisles. Don't even go in. Yeah.
Absolutely.
Well, cool. Yeah, I appreciate it. I start my day, I have a family history of heart disease and high cholesterol. And a couple months ago, I had, I think it was 168 LDL at 32. And I kind of had a rude awakening. I had a brother pass very young of a heart attack as well. So I've kind of done a whole, redo of my diet and exercise routine. Part of that is a morning shake. And in there, I'll just tell you give me some feedback. 2 bananas, an avocado, blueberries, olive oil, honey, cinnamon, and a little bit of vanilla extract. And then it's all in water.
Yeah.
And then I put a couple supplements in there, L-citrulline, L-arginine, and a little bit of creatine. And that's how I start my day every single day. What do you guys think of that? Just curious.
Yeah. I mean, that sounds good to me. I definitely like the berries, right? That's good for your fiber. And you've got some amino acids in there. You've got
spinach as well. Forgot to
spinach,
like a big handful of spinach. I forgot to mention that.
Spinach is good. One thing that sounds like an awesome smoothie, actually. And one thing to definitely just be careful of, because I made the mistake, just for everyone, not like you in particular, but just everybody, is it's really easy to go super enthusiastic gangbusters on the greens. And if you overdo the greens, they have a lot of oxalic acid in them. There's a compound called oxalic acid. And if you're not getting enough citric acid, like orange juice, lemon juice, things like that, and enough water, if you're dehydrated, then you can develop kidney stones.
Really?
And kidney stones are definitely not fun. So nothing wrong with doing the smoothies. So it's not an if, it's more of an and with the smoothie, also make sure adequate water intake, adequate citric acid intake. And you can find articles on the web that'll kind of show you what the ratio should be. And then it's good to rotate your greens as well. So like maybe spinach one week, and then maybe arugula the next week, Swiss chard the next week, that sort of thing.
Okay.
Yeah.
So maybe squeeze a lemon into it.
Yep.
Okay. Because they kind of counter each other is what you're saying?
They do. Yeah.
Okay.
Yeah.
Good to know.
Otherwise that you'll get some buildup of stony material in there, and that's no fun.
Yeah. Okay.
In your kidneys.
Yeah. Yeah. Definitely don't want that.
So I'd say, sounds very healthy, but I mean, the vegetables, excellent. Citric acid, sure, but you got a little bit watch out for the fruits, because I mean, fruits are excellent sources of fiber, but they also have tons and tons of sugar. I mean, it's a big carb load. So I've had lots of patients who say, I do this fruit smoothie in the morning, and then all day I have gas and bloating and my stools are off and stuff. So it is a huge load of sugar, which may not be beneficial to your pancreas, and the whole other conversation about all those carbs and things. So just balance it out with fiber. But if you're doing a smoothie full of, all these vegetables and fruits, you might have a lot of gas and
nothing out of control to report.
And stuff.
Right.
But probably overall pretty healthy.
Okay.
You can deal with that. Yeah.
Is the sugar and fruit different than how does that work?
I mean, it's more natural, and then there's fiber. And so when it's mixed in with the fiber, your body and your small intestines take longer to absorb it and digest it, and your gut flora throughout your whole intestines processes it a little bit slower. And so then you get a more even distribution of the sugar load. It's not just the processed sugar that goes straight in.
For sure.
And then the fiber obviously is so beneficial to your gut flora and things. And so it's quite a bit better. But
Okay.
if you're talking health benefits of like a kale smoothie versus a blueberry smoothie,
Kale.
Kale
sure.
is probably a little bit better, whereas because you're going to get all that sugar from the blueberries.
Maybe 70% kale, 30% blueberries.
That sounds good.
I love my fruit, man. I eat a lot of fruit. So this is good to know. Good.
Yeah.
I appreciate it. Anything else on nutrition?
Yeah, I mean, and definitely correct me if I'm wrong. My understanding with the fiber as well is 30 grams of fiber a day is what you should be shooting for. You let me know if that's incorrect, but that's what I tell my patients. And then your water intake should be your kilograms in ounces. So like I'm roughly 220, so that's what, about 105
Right, about 100
kilos or so. So that's 100 ounces of water a day.
Great.
And do I drink that? Absolutely not. But that's what I'm kind of shooting for.
Yeah.
You know.
I don't even know how many ounces in a gallon. I don't even know this. 128, I think.
I think that's
Someone
right.
roast me in the comments.
Yeah. But does that sound?
Absolutely.
Oh, is
Right.
it?
Okay.
Yeah, I mean, as long as you're getting a well-balanced diet. Yeah.
Okay.
So most patients that I see are not, especially if they're having issues with constipation.
Yeah. Water,
They're not drinking enough
water.
water.
Is so important. Probably the one thing that most people overlook. And
Processed food and hydration, I feel like are two big ones right now.
Yeah.
Just in the world in general.
Yes.
Right.
Yeah.
Well, let's transition to your practice, Doc. I know you guys are kind of adamant about, colorectal cancer screenings. How do you guys kind of approach this issue?
Well, yeah, I think the main reason I'm here is it's March, and March is Colorectal Cancer Awareness Month. So, and the veteran population generally are retired, and once you get to 45 now, it's recommended that you should start colon cancer screening. So, colon cancer is huge. I mean, it's the second leading cause of death from cancer in the United States, and it's just getting more and more prevalent. And I think in 2030, they have calculated that the younger age group, 20 to 50 years old, that's going to be the highest cause of cancer is colon cancer in that population. So the younger group of people, it's becoming more and more prevalent. The older age group, we're doing okay. And people that have had colon cancer screening from colonoscopies and stuff, we can mediate and decrease your risk huge from getting your colonoscopies and polyps removed and stuff like that. But it's that younger population too that now we're going to need to worry about.
Interesting.
So.
I know we touched on it earlier, but do you really know what factors are causing this, or just we're probably freaking people out? So I'm trying to help people, maybe subside, get on the right side of this before it's too late.
For the increase in colon cancer, it's multifactorial. So genetics is a huge one. The increased prevalence of like inflammatory bowel disease, like ulcerative colitis and Crohn's disease, are all big causes of colon cancer. Diet, red meat, alcohol, smoking are all real big causes of colon cancer, and then obesity. So obese people have a higher risk of colon cancer too. So all of these things, and probably so many more dietary things that we haven't defined yet, is another big reason why this age group colon cancer is getting more prevalent.
For sure. Yeah, I know like getting a colonoscopy and these screenings, it's probably intimidating for some. I've never had one, and that's a scary thing.
We can do that for you. Yeah, no problem.
I'm sure you can. I'm not opposed to it. It's important to get ahead of this, but maybe like let's ease the mind of some listeners. Like this is a very intimidating thing. What does it look like? You've scheduled a colonoscopy. How does the process go?
Yeah. So I've had mine. It is the actual worst part of the whole colonoscopy period thing is the bowel prep. And it's not too bad. I mean, we generally have you eat the opposite of what you should do. You should do a low fiber diet for about 5 days before that. You just had your I probably shouldn't tell you.
Yep.
But,
Good job, Doc.
A low fiber diet for about 5 days, and that's just because fiber sits in the colon. That's the whole, why it's so good, is it's unprocessed and you poop it, most of it out. So so we don't want that while we're doing the colonoscopy. So low fiber diet for about 5 days. Then the day before the procedure, you are on a clear liquid diet. So no food, you just drink a lot of water, and you can do clear liquid, Sprite or Gatorade and those types of things. And then about 5 p.m. the night before the colonoscopy, the next day is when you start the bowel prep. And there's tons of different options for bowel preps. So there's a big gallon of Go Lightly. There's little half gallons of different things. There's some pills that you can take.
That's the one I did.
Yeah.
The pills.
So there's options. There's tons and tons of options.
A lot easier that way.
Yeah. And you generally, take a little bit of that then, and then you'll be going to the bathroom quite a bit. Then when I did mine, I actually went to sleep, and then I got up at about 5 a.m, and then I did the second half of the bowel prep. And then, you're going to the bathroom a lot. And then you go in and get your colonoscopy. When you go in and get the colonoscopy, that's the easy part.
Really? I think that's the intimidating part.
Yeah, I know. That's what a lot of people think.
So what does it look like, the procedure? Like how?
The procedure is generally sedated, and it's not like you're intubated like a surgery. This is just a go to sleep sedation. It's various things, but propofol is what we use.
Yeah.
And people just fall asleep, and it's very comfortable. They don't remember any of the procedure. There's no pain after the procedure. They don't have any side effects of the procedure itself. It's just kind of waking up from the colonoscopy afterwards. But the procedure itself, everybody after they leave is like, oh, the prep was
worse.
The worst. The procedure's really easy. So.
It's always the anticipation of anything.
And I didn't think the prep was that bad, but
yeah. Okay. Well, that's good to know. I feel better about it.
But it's important. I mean, the big thing is you're screening for cancer. So we're looking for cancer, but the big thing is that we're preventing cancer. So polyps, cancer begins in the polyps, and it's so easy during a colonoscopy to just snip these little polyps out and prevent any colon cancer from coming. So people that have had colonoscopies, their chance of ever having colon cancer after having the colonoscopy is dramatically dropped, 70% less rates of any colon cancer. And the people that end up having colon cancer are the people that don't get their second colonoscopy or the third colonoscopy or the intervals after that.
I see. Do you see any younger generation coming in, like people in their 30s, just because they're kind of trying to get ahead of it, or?
Yeah, for insurance reasons and for indications, you'd have to have an indication, but changes in your stools, diarrhea, blood in your stools, like even hemorrhoids and stuff are all indications.
Okay. So. Interesting. Good to know.
Cologuard certainly has its place, but the Cologuard is a stool test that you do at home, where you just take a little bit of your stool, you package it up, send it back in, and they check it for, the company checks it for things. It's 2 parts. One is this kind of DNA test that they amplify. It's a KRAS mutation that they find. And then the other part is just blood, hemoglobin in the stool. And any one of those 2 things that come up positive is a positive test. So if you have hemorrhoids and you bleed a little bit with hemorrhoids, that's going to be a positive Cologuard test. Yep. If you ate a big steak dinner that's on the rare side the night before, that's going to be a positive test. So there's lots of false positives in this thing. So it's not necessarily a way to get away from not doing a colonoscopy, because if you have a positive Cologuard, that means you should go to get a colonoscopy. But the other thing is that these tests, the Cologuard test, the stool study, it'll only try to detect colon cancer. And by then, you may be too late. You may have caught it early enough to treat it. You may have caught it at a position that when you do start treatment, it'll prolong your life, all those things for sure. So it's okay. But what a colonoscopy does is prevent cancer. And you want to find these polyps before they become cancer, remove the polyps, and then you never have to worry about cancer ever. So it is a test. It's okay if you just absolutely don't want to have a colonoscopy, but you just have to remember that if it's positive, you're still going to need to get a colonoscopy. It only detects anywhere from 90 to 92% of colon cancers. So gosh, even if you do this test, you're still going to miss some. So if you're not going to get a colonoscopy, do the Cologuard for sure.
Makes sense.
If you really want the best test to prevent colon cancer and to find colon cancer, do the colonoscopy.
Maybe from you, Eric, because you're a family practice, is that right?
Yep. What
trends, this is just generic from the perspective of a provider, what trends are you seeing throughout your time as a provider, over 20 years at this point? What trends are you seeing getting worse in the population, and what trends are you seeing getting better? And then in regards to the negative trends, how do you see those continue if they're not prevented? Just kind of, in your general populace that you see.
General trends in the population. Wow. Yeah, you're going to get me started. So, I'm seeing a lot of people who are not interested in eating a healthy diet. They just kind of eat whatever. And then they wonder why they have issues with their bowels and issues with sleeping and issues with weight gain and things like that. And I'll offer people, hey, would you like to go to see a dietitian or a nutritionist? I would recommend that for anybody, no matter, even elite athletes. I mean, people that do Olympic stuff and CrossFit and all that, all the way down to people who are sedentary. Anyone could benefit from talking to a nutritionist about how to have a better diet, which is a lot of what we talked about today. But people tend to be really not interested in that. I'm still seeing a lot of smoking, believe it or not. I'm seeing a lot of people that are depending on benzodiazepines to go to sleep, like Xanax and Klonopin and things like that. And before you reach for the Xanax, before you go to the doc for the Xanax, it's a really good idea to try to modify your lifestyle and all that stuff first before you just default to those heavy hitting meds. I'm seeing a lot of narcotics.
Really?
Especially in the older population. A lot of older people who are using narcotics on a regular basis because they're treating both chronic musculoskeletal pain as well as depression and anxiety.
Like prescribed narcotics?
Oh, yeah.
Okay.
Yeah. Women, particularly men too, but a lot of women in their 80s and 90s, I got to the practice and found that a lot. And I'm trying to get them to dial back a bit. Because the combination of narcotics and benzodiazepines and things can predispose people to falls and things like this. I
would imagine you're pretty sedated at that point.
Absolutely. And people that already have underlying respiratory issues that can exacerbate those if they have COPD and congestive heart failure and things like that. I'm seeing a lot of people that are not interested in getting colonoscopies. So that's another thing I always try to push it. I had mine recently, actually at Dr. Hjelkrem's office. Wasn't him, but it was his colleague. Amazing staff, amazing facilities. It was really actually very well done, just, as a sidebar, with that particular office. And, it really wasn't that bad. It's just like Dr. Hjelkrem said, it was the prep more than anything. So now that I have that experience under my belt, like colonoscopy number 1, I always try to quell people's fears and say hey, I understand you're freaked out. That's why I put mine off for 5-6 years, but then I did it and it's it actually wasn't that bad. And I've had some people decide to go ahead and do it because of that, but a lot of people shy away. So those are kind of the trends that I'm seeing. I'm seeing a lot more obesity. I'm seeing a ton of hypertension. I'm seeing a lot of people who want to use meds to lose weight rather than diet and exercise, like Ozempic and.
You want to talk about that real
meds
quick?
Like this? Absolutely.
I don't know anything about Ozempic, but I just know it's a hot topic right now. my layman's brain, I can't imagine that taking medicine can be healthy to lose weight versus diet and exercise.
It really isn't, and Dr. Hjelkrem probably actually knows more about the GI side of this than I do, but what I find is that people will try to take something like semaglutide, Ozempic, like one of these meds, Wegovy, right? And it's been popularized in the media and some celebrities and things, and they're like, oh, what could be easier than just having an injection once a week, and I'm going to just, the pounds will melt off, right? And a lot of people develop like really severe vomiting, nausea, lots of diarrhea. And I have heard, and again, don't quote me from like the standpoint of a randomized controlled study, but what I have heard is that people lose a lot of muscle mass as well, that they can't gain back. And what would you have to offer on that? Because I know you have to see people that.
Yeah, I see a ton of side effects of those because it's a lot of GI stuff: nausea, constipation, diarrhea, upset stomach. I mean, that I think that's probably one of the big drivers of the weight loss is you're so nauseous that don't even want to eat anymore. Right. But yeah, I mean, there's also bad side effects like chronic pancreatitis or bad pancreatitis that people can get. Now, I don't want to be too much of a naysayer because there are some good benefits of those things too. I mean, especially if you have diabetes and you're on these medications, they can really make you lose weight and make sure you're eating and you don't eat as much and it can help the pancreas work a little bit better. And so there are some really good benefits of that. And if it's the only thing that, if you can't do the diet and exercise, or you've tried that and you keep bouncing back and forth, and this does help you to lose weight, I think those are good things. I mean, I just am cautious because they're pretty new, so I don't know exactly what's going to be found long term on some of these things. But I mean, there's good and bad to all of them, and I see lots of people on them. One thing that we see too is one of the reasons it causes nausea and things is, and the decrease in your appetite is, it just slows the emptying of your whole gut. So your stomach doesn't empty, so you have a bunch of food sitting in your stomach sometimes for days. Your whole lower intestines and things don't have that peristalsis much anymore, so there's risks of aspiration, more heartburn, acid reflux, and those kind of things. But again, if that's the one thing that you're losing weight for, then I think trying it in a stable situation where you're getting monitored and you can avoid some of these other things, maybe. I don't know I don't prescribe it, but I know a lot of people who have had diabetes and difficulty with their weights, and it's working for them. So I don't want to be a total naysayer.
Yeah. So in a more emergent situation, someone's already overweight, someone already, predisposed or has diabetes, this would be a way to pull them out of it, or at least improve their condition. Totally get that.
It's definitely indicated for, I mean, that's primarily what it's for, right? Is diabetes. And like Dr. Hjelkrem said, I mean, absolutely. And it's even, in the new guidelines that came out now, I want to say it's even preferred to metformin, or it's more first line than it used to be. Most people that are looking for Ozempic don't have diabetes.
Okay.
Yeah.
Yeah. Thanks for elaborating on that. Yeah. Any other trends you're seeing that you wanted to cover?
Lots of diabetes. Actually, lots and lots of like new onset diabetics, and they're getting younger. Age range, I was going to ask. Yeah. I'm seeing people that are 35. 40 that are new onset diabetics. What are some signs of early diabetes? Like other than, you're obese, have a bad diet, but like someone starts feeling something, right? Yeah. Well, typically someone that's developing diabetes are going to be having a lot of, just really unusual fatigue. All of a sudden they'll have abdominal pain. They'll, a lot of easy fatigability. They will have frequent urination. They'll find themselves hungry despite the fact that they're eating, but they can't satiate that appetite. Like they're hungry all the time. You'll see that happen, or frequent urination. We talked about it. nausea, vomiting, headache, brain fog. And typically by the time you get to that point, you're kind of in a clinical state that you don't want to be in. I actually just saw a guy the other day that I had to send to the emergency room because he was in something called diabetic ketoacidosis, or DKA, where basically you've crossed a line into diabetes and then some. And you've got all this sugar hanging out in your blood that can't find its way into the muscles and organs where it needs to go because you're basically just out of insulin. And so your body is burning fats instead of the sugar that you would have access to if you had the insulin that your pancreas is not producing, if that makes sense.
Totally.
And so then the body has a very specific pH range that it likes to sit in. And if it gets below that, then you're going to get really ill. And so that's the diabetic ketoacidosis, and that can be life-threatening. It can cause seizures and coma, actually. So a lot of people end up in the ICU, and they'll present just like that. And I've had patients that presented that way. I sent them to the emergency room, and then that's where they discovered that they were diabetic, and then they were released on insulin.
Wow.
So
fruity breath smell. You ever experienced that?
Ketones. Yep. Absolutely. Fruity breath. And a lot of times people don't have the words to describe. They'll just say, "Oh, I don't know, doc. I just don't feel myself. I just feel really off. I've never felt so awful." Like,
is this something you can start to repair early with diet? I'm sure.
100%.
For sure. Yeah.
Yeah.
Stop eating sugar.
One of the best things you can do for yourself, and I'm working on that personally myself, is just because everything's got sugar in it, right? Pasta sauce has got sugar, and so many foods have sugar that's just like added to it. Bread and stuff like that has added sugar. Is just start with trying not to add any sugar to anything, and start with not just overtly eating sugar, like runts and gummy bears and things.
Ice cream.
I ice cream, and I love some gummy bears, man, like and cookies and things like that, you know. But you can start to back off, like maybe I'm going to do this every other day, or maybe like just on Saturday I'll have like a dessert or something and try to taper that down. And then just getting 150 minutes a week of cardiovascular exercise, like moderate cardiovascular exercise, just brisk walking or exercise bike or something like that. Doesn't have to be, you don't need to go out and do a triathlon or anything like that. Sure. Just like, and if you can only do 10 minutes a day, that's fine. You just do that for a while, and then you can slowly kind of build up, and that will do wonders for just really backing off the propensity for developing diabetes. You can reverse that.
Okay. Good to know.
Absolutely. Can everybody reverse it? No.
Yeah. Depends how far you are, I'm sure.
Correct.
Yeah.
But most people can reverse it.
Okay.
Yeah.
The last thing I wanted to ask you about, we were talking a little bit before we started recording, was the benefits of a sauna. I know you're pretty adamant about this recently, but I would love to hear about it and share it.
Absolutely. Well, we were talking a little bit about Andrew Huberman. He is professor at Stanford who has this awesome podcast called the Huberman Lab podcast. And I was looking at some of his podcasts as well as just podcasts, like other podcasts on YouTube. If you have access to a sauna, and if you can do it safely, highly recommended. Obviously, if you have high blood pressure, high cholesterol, and heart failure and COPD and things like that, I would talk to your doc first, right? You want to get cleared, or seizure disorder or something like that. You want to get cleared by your doc before you start using a sauna. But if you're like relatively healthy person, really no medical conditions, you can totally pop into a sauna 10 to 20 minutes, 4 times a week at a temp of about 190 degrees or so. And you can go higher than that, but at least 190 degrees. And that will enable your body to release something called heat shock proteins. And I'm not a huge expert on what those are. You would, but Huberman is. So definitely take a look at that podcast. But those are just very beneficial in terms of repair, cellular repair, and tissue repair, and lowering one's I guess, propensity for heart disease, developing heart attack and stroke and things like that. It will actually help to reverse a lot of those. If you have genetic predisposition for that, it will actually help to reverse a lot of that stuff. And also really good for people who have any predisposition for dementia, Alzheimer's, and things like that. There's actually going to be a much lower likelihood of you developing that if you're doing this on a regular basis. So 4 times a week is what it's recommended.
How long do you stay in the sauna?
About 10 to 20 minutes.
Okay.
Yeah, 10 to 20 minutes. At 190 or higher.
Okay.
Obviously, make sure you hydrate well. Make sure you have a timer going, and be safe about it. Right. If you're starting to feel lightheaded and things, get out. It's a good idea to have someone there with you. But if you can't, I mean, that's okay. Yeah. But you definitely want to be safe about it, because anything can become unsafe. Right. But and there's even, just as a quick, very quick sidebar. There's a gentleman by the name of Wim Hof who actually has a lot of information out about the exact opposite of this, which is cold therapy. So one really good way to maximize your physiology is to do sauna, and then after that, probably a cool down period. Then do like a cold shower, releases all types of endorphins and positive chemicals into your system. Helps the wakefulness, helps sleeping, helps digestion, helps all kinds of stuff. So it's just, I'm still learning about it, but what I've experienced so far has been really beneficial for me. Okay. So
the sauna sounds a lot nicer than the cold.
Yeah, it is a lot.
I'm not a cold person.
It is a lot nicer.
The cold is hot unpleasant. Tubs work? I really like hot tubs.
Ooh.
Yeah.
Okay. Yeah, I would imagine, right?
Yeah.
Hot tub sits at like 110 though, 112 water temperature.
Right. Yeah. Right.
So I don't know.
But hot tubs are,
same principle.
It's the same principle as like, the whole Rocky Balboa thing. Like you wrap up in sweats and go out for a run. Like, and they say it's the same thing, but sauna is just another way of really getting your body temp up. And it's not about overheating, right? It's a very controlled, like, set period of time. Yeah. So.
Yeah, I knew saunas were good for you, and my impression was, you're hot, you're vasodilating everywhere. So you're increasing blood flow to your brain and your heart, to your feet, everywhere. Right. I didn't know there was actually, what was it called, heat shock proteins being released. Yeah. There's a whole nother aspect of it.
Absolutely. And there's a lot of data out there on YouTube, and I'm blessed to actually have a sauna at home, because it was there. It was in the house when I bought the house, and I didn't use it for like 4 years, and then I just recently started using it every day. Like, that's part of my morning routine when I get up at 4 o'clock or 4:30. And couldn't be happier with it. I feel so much better.
Cool. Good to know. How has medicine been different from the military versus civilian world? And then we'll wrap up. I'm just kind of curious.
Yeah, good question. For me, it's the population. I mean, the military has been a younger population, so you see a lot of different diseases that are associated with those younger ages. Like when I was in the military, I saw a ton of inflammatory bowel disease, ulcerative colitis and Crohn's disease, and less colon cancer and those things. So in the military, I saw a lot of things like alcohol and side effects of marijuana use and those types of things. And I mean, I still see that now.
What are some side effects of marijuana use that you see?
If you use it a lot, the biggest side effect would be chronic nausea, which is a little counterintuitive. And when someone comes in and they have a ton of nausea, they usually are sitting down and telling me, no, it's the marijuana. That's the only thing that helps the nausea. Well, you get to this state where your body needs it around all the time in order to stop the nausea, but it's the actual thing that has caused the nausea to begin with. So you're now at this level where it has to be on all the time or else you don't have nausea. Well, it caused the nausea to begin with. So really, to stop all the nausea, you'd have to stop the marijuana.
I see.
And it takes a long time. So months sometimes.
Yeah.
But and that's big time chronic marijuana use.
Okay. Yeah. Gotcha. How about you, Eric?
I saw a fair amount of pathology on active duty, especially when I crossed over from just active duty only members to the retirees and dependents. But I would say by far I see a lot more pathology now just because my patient population's a lot older. They're in their 60s and 70s and 80s, in some cases 90s. You don't see many 90-year-olds on active duty, so
probably zero.
Right. Like as retirees, because retirees typically at age 65, then they're released to, from the military medical system. So I see a lot more pathology, but I would say the encouraging thing is that a lot of these older patients would not, in many cases, are just super, super healthy. And the reason that they're 95 is because they're healthy, because they've been taking care of themselves. So that's really encouraging. I'll see people that are 95 that are on like no medications or 2 meds or something, and they go hiking every day. And I'm just like, wow, like I want to be you, So I see that too.
Okay.
Yeah.
Okay. Good to know. I was just curious, that's a big transition. Like it was the same job title, the same profession, but different populace, I guess.
Definitely. Yeah.
Right. And you don't have to go to Iraq anymore.
Don't have to go, right, exactly. Don't have to do that. I do see a lot more in the civilian sector, a lot more people, using cannabis as well, which I don't have necessarily strong feelings about one way or the other, but I do see a lot more of that. And that does, like Dr. Hjelkrem was saying, that throws a spin on things because now I have to think about that. Whereas like on active duty, I didn't really have to think about, is this person using something in most cases. But now I do see people that are
addicted.
They're using meth, they're using marijuana, they're using like cocaine and things like that. And it's like, okay, and no judgment here, right? But I'd rather know than not know, so that I can best address their situation,
Yeah, there's 3 people you don't lie to: your doctor, your lawyer, and your therapist.
Exactly.
Well, I had a great time today. I appreciate you guys coming on.
Absolutely.
Thanks for coming on the Veterans Voice podcast, Dr. Abbott, Dr. Hjelkrem. Hope to talk to you guys soon. We'll plan out another one in the near future, but until then, I hope you guys stay well.
It's always a pleasure. Thank you.
Thank you for having us.
Thank you very much.
This was fun.